So we live in Maharashtra, Mumbai, and majority of the donations which happen in Maharashtra and Mumbai actually happen in private sector. But there are several states in the country where the government sector is ahead of the private sector in terms of organ donation. Similarly, all the transplants, majority of the transplants right now are happening in private sector. However, in the last 1 year or so, couple of our public hospitals have gone ahead and done liver transplants and heart transplants very successfully. And similarly, across the country, there are several government institutes which actually have very well established transplant programs plus training programs. So they are doing so many cases that they are training doctors and nurses to be expert into the transplantation process. So the myth here is that organ donation is only for people who are rich and rich give it to the rich. That's not true. It's a process which is so transparent that if you are a potential organ recipient, you have to register yourself with the local state government authority. In Maharashtra and Mumbai, the authority is called as ZTCC, which is again having another body which sort of looks over it, which is the SOTO, the State Organization for Organ Donation, Organ and Tissue Transplantation, followed by the NOTO, followed by the ROTO, which is the regional one, and then the national one, which is the NOTO. So it is heavily governed by rules, heavily governed by the Act of 1994, Human Transplantation and Human Organ Act, and it has got its rules and regulations, which the local authority, which is a completely neutral body, makes sure that it is implemented all the time. So they maintain a waiting list, and the organ is allocated to the patient, not to the hospital, so that the patient does not miss out on it. Similarly, even if you are a rich organ donor or a poor organ donor, every donation has to be reported to ZTCC. Only on the instructions of ZTCC does the donation go ahead and the transplantation of organs.